Welcome to Behind the White Coat. I'm Kerry Briggs. This is a new podcast that I am starting dealing with medical issues, and this is the very first inaugural podcast. So, Behind the White Coat by Kerry Briggs. I am a physician assistant. I'll get into all that a little bit here. Before we get into anything, I will always read this. The information on this site is for educational purposes only and the opinion of the author. This is not a substitute for professional medical advice, diagnosis, or treatments. Always seek advice of your physician or provider with any questions you may have regarding any medical condition or treatments. So this is basically going to be an educational channel on medical, and I'll explain it a whole lot more. So basically, who am I? Well, my name is Kerry Briggs. I started my medical career in the medical field as an EMT paramedic, and I became EMTP in 1982 and held that license until about 2002 for almost 20 years. Worked in private ambulance for 10 years, and then I worked in a fire department for 25 years. So in 1997, I went back to school to become a physician assistant, which I did in 1999, and so to present. So I'm on my 27th year and counting as being a physician assistant. And I've worked in mostly ERs. I did 22 years of ER medicine, anywhere from inner city hospitals to community hospitals to a level 1 and level 2 trauma centers. So over the years as a paramedic, I saw and I picked up a lot of people who basically had evidence of man's inhumanity to fellow man. A lot of people that were injured, including gunshots, stabbings, person being assaulted, as well as the person who has a medical condition and needed to go to the hospital, couldn't get themselves there, and was able to help a lot of people make that process from home to the hospital, where we would take them to the emergency room and we would drop them off and we were done. And then it was up to the ER to fix them, if they could. Sometimes they couldn't. As a PA, however, I was on the other side of that coin, where now people were being brought into the emergency room, and now it was my job to assess them, do the testing needed, and treat them to hopefully get them better. It's quite a bit different when you're as a paramedic in a field. You package them, you get them, and you clean them up and you get them to the emergency room, and then it's their job to go from there to actually figuring out everything that's wrong and trying to correct that. And that's quite a bit different when you're on the other side of that. So why am I doing Behind the White Coat? So in my years of experience, I've seen a lot of changes in medicine, and probably the most eye-opening was during a time when COVID hit. what I saw happen to people, how I saw the medical community respond, both positive and a lot negative, it started me on a path of just questioning, what in the world are we, the medical people, what are we doing? And as time went on, seeing how people had really just stopped thinking. I mean, very smart people. I mean, I worked with doctors who were very smart, very intelligent, but a lot of them just kind of, like a horse, put blinders on and stopped asking, is what we're doing the correct thing? Is this really what we should be doing? Or should we be doing something else? And sometimes they just basically followed what other institutes were telling us, including the CDC, the FDA, the NIH, the American Heart Association, and the WHO. We were getting information from them like we had always in the past. And, it wasn't unusual to get information from them, but it took what we were taught and what we were being told. So it was kind of the normal thing when COVID came along. Well, then once it did, I started looking at it, and I am a questioner. I'm like, why would you do that? That don't make sense. Why would you give that medication? Why would you do this? Why would we do this to people? And I basically knew early on that Fauci was, well, we'll keep it clean, was full of feces and lying and not telling us the truth about COVID. I was in a situation where a lot of times I couldn't even express that because this was the standard. Yeah, but should it be? That was always my question. So I realized that what he was saying, even on the little stuff, the little details, wasn't accurate, wasn't correct. And that started me asking a lot of questions. And the unfortunate thing was that a lot of the smart individuals that I had worked with, doctors, weren't asking those questions. They were just, like normal, taking what the CDC, the NIH, the FDA, what they were saying, and saying, okay, this is what we got to do. And very few were questioning the process. So once I realized there's something horribly wrong here, and then I started to look to other countries. I looked in Italy and Germany and Israel, and what were they doing and why were they doing it and what were the results. And not a lot of times, 30%, 40% of the time, I was like, well, why aren't we doing that? Why are they doing that who had it before us, and we're not doing it? We're doing this other thing that doesn't seem to really be working. So there was a lot of questions, and again, a lot of me wondering why. So now, years past COVID, and the discovery that basically that the CDC, the NIH, the FDA were not telling us the truth. They were not upfront with it. They would make policies and procedures, and they weren't tested. They weren't they weren't proven, and so then again made me question, well, why? These are institutions that we're supposed to rely on. What's going on here? Well, a couple things I've found out since of what's going on. So there's this big revolving door between the CDC, the FDA, and the pharmaceutical industry, where people are in the FDA, the CDC, NIH, and then lo and behold, they leave there and they go get this huge dollar salary with pharmaceuticals. And if you look at that and you think of anything other than, that seems like a conflict. How can we trust what they're saying when they kind of have their hand in two cookie jars? So I started looking at some of that, and the interesting thing is, according to the Low Institute, LOWN Institute, the government created foundations for many of the government organizations, including the CDC and the FDA, where early on they were private or they were government funded. Now they could be more privately, there would be more private money coming into them for their support, to the tune of $161 million. So an example of this is Roush, ROCHE. They contributed to the CDC $193,000, and Roush is the maker of Tamiflu, and so they have given $193,000 to the CDC for their flu prevention campaign. Tamiflu is for flu, and we're giving you money for that. And what do you think that they will do? Well, use Tamiflu. Well, so on this show, I'm going to talk about medications, and one of them, Tamiflu, that we've just mentioned, is an awful drug. And I will explain that at some point, but anyhow, so you can see there's a conflict of interest there. A conflict of interest there. Recently, the CDC, this is still from the Low Institute, recently the CDC accepted $3.4 million from Pfizer for prevention of cryptococcal diseases, which cryptococcal diseases are fungal infections that cause pneumonia. They can cause meningitis, and for people who have weakened immune system like HIV, and you're more susceptible to it if you were on these suppressive drugs for autoimmune diseases and that. And so they've given $3.4 million for that. $1 million from Merck and Company. They're a pharmaceutical company, for the program of preventing maternal mortality. And $750,000 from Biogen for a program of screening newborns for spinal muscular dystrophy. So if these companies are making medications for that, certainly what, it looks like, well, see how good we are, we're giving money so that you can research that. But there's another side to that coin. When you flip it, there's always that other side. And the other side is they're funding things, they're funding research. So where do you think that's pointing? Do you think that it's pointing against them, or maybe a little bit for them? So to me, there's a real conflict of interest, and that's what happened once they started allowing private money to come in. The Food and Drug Administration has moved from an entirely tax-paying entity to one increasingly funded by user fees, that they are paid by manufacturers that are actually being regulated. And today, close to 45% of its budget comes from these user fees that companies pay when they apply for approval to the FDA for either pharmaceuticals or food manufacturing, and even medical devices. So when they apply for approval for these things, you know, they have to pay a user fee. Sounds like, hey, we'll give you X amount of dollars if you approve this. So the American Heart Association gets $39.7 million a year from pharmaceuticals, biotech, and medical device manufacturers. The American Heart regulates treatments for hypertension, cholesterol levels, cardiac medications, which is a huge amount of drugs that are used for these modalities, for these diseases. And if there's things that have come up in research that points towards, hey, do this or use this medication or whatever, if you're getting $39.7 million a year, let's just call it $40 million a year, which way are you going to lean? Are you going to lean away from them so that you lose that $40 million? I don't think so. So to me, it's a conflict of interest that should not be there. And it actually, these organizations, what it actually does is you look at them and go, well, what is the truth? What is the real deal? Who is funding these studies? And are these studies biased towards what they're funding? So it really brings up some questions to me. The American Academy of Family Practice gets 11% of its budget from pharma. The American Association of Pediatrics, they don't disclose the amount that they receive, but from 2017 to 2023, it showed that they received $293,000 in payments to executives for the American Academy of Pediatricians, who are making decisions on what do we do, how do we treat, what do we use to treat pediatric patients, and they're paying for consulting fees, traveling fees, and meals to the tune of $293,000. On their own website, it says that their top corporate sponsors, so not only are they given money for that, but they can also be a sponsor of the American Academy of Pediatricians in the tune of anywhere from $20,000 to $50,000 each. And on their website, the top corporate sponsors of the American Academy of Pediatrics is Merck, Moderna, Pfizer, Sanofi, Abbott, Gendex, CSL Sequis, Mead Johnson, Eli Lilly, and By Heart. All of these are drug manufacturers and or like medical devices and that. So they're contributing to the AAP being funded. And again, if they're funding you, that is a conflict of interest in my mind. You cannot tell me that a person's going to go, oh, well, we're going to do something that they say we shouldn't do, that that organization, and then lose that money. I don't think that that is very good thinking on anyone's part. So, by the way, Pfizer is now celebrating 175 years of existence, and with that, they are also happy to announce that they, in 175 years, have not cured anybody, because the medications that they give you take care of symptoms. Nothing works towards the cure. Well, congratulations, Pfizer. And why is that? Because we need repeat customers. If we cure you, then you won't buy our drugs. So I've kind of got off topic because it's just kind of explaining, but you can see what process I went through and some of the study that I've done and the research and looking at this stuff and going, this shouldn't be this way. So I'm kind of straying off topic here since this is the first one. But what it also made me do is start looking at different diseases and treatments and that, like hypertension, diabetes, heart issues, and on and on. And I'm continuing to look at that and what do we do? What are we doing? And one, is it beneficial? Two, is it helping to cure someone? And if not, then what? Maybe we should be doing something else. And so all these questions are going, and this is what we're going to, what I'm going to talk about is different diseases, different medications for those diseases. What are the good, bad, and the ugly of those? What are the side effects? Are you being told what the side effects are? I'm going to say you're not very often. And I can say that with a lot of confidence because of what I do. So, and the problem is, in a lot of cases, we, the doctors and PAs, have not really been honest with our patients. Many have the attitude, just do what I say and take the medicine and move on. I'm the doctor, I'm the PA, and I've actually had patients tell me that their doctor said this to them. Just take I'm telling you, take the medicine, take the medicine. Well, doctor, what's it going to do? What's it for? Just take the medicine. You need it. If that has ever happened to you, if you walk into a doctor's office or a physician assistant, nurse practitioner, anyone, surgeon, whatever, and you walk in and they give you that, you go, thank you very much. Your next action is to find another doctor, because that one is not doing what he or she is supposed to be doing. Well, working where I do, so I worked 21 years in emergency medicine. Last 5 years and counting, I'm in urgent care. And I've actually had patients come in and I'm like, okay, why are you on this medication? Well, I don't know. My doctor told me to take it. Okay, so your doctor told you to take this, but you don't know why you're taking it? No. Okay. Did your doctor tell you about the side effects of this medication? No. Has your doctor told you what to look for on these side effects? And the answer to that question right there is 99.5% of the time, no. And that is one of the failures and tragedies of modern medicine, is that doctors gotta push patients through. You're in a hurry. Well, your job is to tell the patient about the medication, why they're going to be on it, what it's going to do, what the side effects are, what to look for. And if you don't want to do that, quit. Quit. Where I work, I come in, I see patients, they give us patient lists of medications or whatever. I've had patients come in that are on EpiPens. EpiPens can save your life. EpiPens can take your life. But if you need an EpiPen, you should have an EpiPen. And I will ask them, has anyone ever told you when and how to use it? And if you do, then what? And 75 to 80% of those people say, I don't know. I guess if I have an allergic reaction, I take it. And I'm just like, no, that is not. And I will go in and explain to them how to use it, when to use it. If you use it, you go to the ER. You need to be monitored. This medication, although it will save your life, it also has a great effect on your heart, and you need to be monitored to make sure that nothing else happens. And doctors are not even telling their patients that. They're just handing out EpiPens. I don't get that. I don't get that at all. I must admit that sometimes I have fallen into this same kind of pattern until I realized that a lot of the truth that we have been told is in fact, maybe at best, partially true. That it's not the whole story, that it may not be the best thing for the patient, but because the medical community says, oh, this patient should have this because of this. I guess I could say I don't trust those organizations any longer. Not when what has been revealed in the last several years of false documentation, of knowing harms and side effects and long-term effects of medications that were being withheld and not even told to the doctors and PAs and nurse practitioners who are prescribing these medications, and that they're not being told, so they're doing what they've been told and what they've been trained to, and yet they haven't stopped and asked the question, why, what, how, when. And so that's kind of the reason why I'm going to do this podcast. I'm going to give information about diseases, about treatments, some possible alternative treatments, and try to give you the truth. Try to say that thing out loud that's not supposed to be said, of not only here's your disease, here's your treatments, but these medications can do this for it, and it can do this against you. In other words, the side effects. So we're going to talk about the benefits and the side effects of medications also. You know, the thing with medications is I already mentioned this, that Pfizer is 175 years, but yet they've never cured anything. So will this medication that I'm on, will it cure me, or is it going to be a lifelong journey that I have to be on with this medicine, and it's not really curing anything? It's just keeping the wolves at bay. And is there other alternatives that may actually be more beneficial to my overall health than what is being spewed at this time? So that's kind of the who I am. That's kind of the purpose. That's kind of the things we're going to look at. And I wanted to put in there, where in the last 5 years, 6 years, the trail of medicine, where it has taken me, and it's taken me to the point where I'm like, I'm done just believing. I'm now researching, and I'm going to bring all that out to you. So if you like this podcast, like it, share it, copy it, send it to somebody, whatever, and we will continue with different kinds of diseases, medications, etc.